Cardiomyopathy. It's an cardiovascular disease. Look at this picture, shows that CT findings, MRI, echocardiogram findings, and ECG findings. Detail going on. Introduction. Cardiomyopathy is a disease of the heart muscle that affect its size, shape, and structure. This condition can lead to heart failure and other serious complications. Definition. Cardiomyopathy refers to group of diseases that primarily affect the myocardium, heart muscle itself, impairing the heart ability to pump blood effectively. Types. 1. Dilated cardiomyopathy, characterized by enlarged and weakened left ventricle. 2. Hypertrophic cardiomyopathy, involves abnormal thickness of the heart muscle, particularly the ventricles. 3. Restrictive cardiomyopathy, the heart muscle becomes rigid and less elastic, hindering proper blood flow. 4. Arrhythmogenic right ventricular cardiomyopathy, fat and fibrous tissue replace the heart muscle, particularly in the right ventricle, leading to arrhythmias. 5. Unclassified cardiomyopathy includes other forms that do not fit into above categories. Causes. 1. Genetic factors, family history, and inherited mutations. 2. Medical conditions, hypertension, diabetes, thyroid disorders, and other chronic conditions. 3. Infections, viral infections that influence the heart. 4. Toxins and drugs, alcohol abuse, cocaine use, and certain chemotherapy drugs. 5. Nutritional deficiencies, lack of essential nutrients like thiamine. Risk factors. 1. Family history of cardiomyopathy or heart failure. 2. High blood pressure and coronary artery disease. 3. Diabetes and thyroid diseases. 4. Excessive alcohol consumption and drug abuse. 5. Obesity and sedentary lifestyle. 6. Certain chemotherapy and radiation treatment. Complications. 1. Heart failure. 2. Blood clots, embolisms. 3. Arrhythmias, irregular heartbeat. 4. Sudden cardiac arrest. 5. valve problems. Pathophysiology. Cardiomyopathy involves changes in the heart muscle cells and the extracellular matrix, leading to abnormalities in contraction and relaxation. Structural alterations and sometimes conduction system abnormalities. This can result in impaired systemic and diastolic function. Signs and symptoms. 1. Shortness of breath. 2. Fatigue and weakness. 3. Swelling in the leg, ankle and feet. 4. Chest pain, especially after physical exertion. 5. Palpitations, irregular heartbeats. 6. Dizziness, lightheadedness or fainting. Diagnosis. 1. Physical examination, listening for heart sounds, checking for swelling. 2. Electrocardiogram, ECG, measures electrical activity of the heart. 3. Echocardiogram, ultrasound of the heart to assess structure and function. 4. MRI and CT scans, detailed images of the heart. 5. Blood test, check for marks of heart damage and other relevant conditions. 6. Genetic test, identify inherited forms of cardiomyopathy. Nursing diagnosis. 1. Activity in tolerance related to decreased cardiac output. 2. Fluid volume excess related to heart failure. 3. Impaired gas exchange related to pulmonary congestion. 4. Anxiety related to health status and prognosis. 5. Knowledge deficit regarding disease management and lifestyle changes. Management. 1. Medications, ACE inhibitors, beta blockers, diuretics, anticoagulants and antiarrhythmics. 2. Lifestyle changes, dietary modification, regular physical activity, avoid alcohol and drugs. 3. Surgical interventions, implantable cardiovascular defibrillators, ICDs, pacemakers, heart transplants. 4. Regular monitoring, ongoing assessment of heart functions and symptoms. Treatment. 1. Medical therapy, targeting underlying causes and symptoms. 2. Surgical options, mastectomy for hypertrophic cardiomyopathy, heart transplant in severe cases. 3. Device implants, ICDs, to prevent sudden cardiac death pacemakers for rhythm management, for lifestyle adjustments, healthy diet, exercise, and avoiding risk factors. Psychosocial medicine. 1. Support groups. Connecting with others who have cardiomyopathy. 2. Mental health care. Counseling and therapy to cope with cardiac illness. 3. Education. Informing patients and families about the condition and management strategies. Prevention. 1. Healthy lifestyle, regular exercise, balanced diet, maintaining a healthy weight. 2. Regular checkups, early detection and management of risk factors. 3. Avoiding toxins, limiting alcohol and avoiding recreational drugs. 4. Managing chronic conditions, controlling hypertension, diabetes, and other contributory diseases. In conclusion, cardiomyopathy is a serious condition that requires comprehensive management involving medication, lifestyle changes, and possibly surgical interventions. Early detection and consistent care can improve outcomes and quality of life for those affected. Thank you. Have a wonderful day.